You're watching CT22 with Eric Parker, sponsored by Hartford Healthcare.
Welcome back. Connecticut officially remains in a COVID civil preparedness and public health emergency, a declaration which allows the governor to issue executive orders. That state of emergency formally expires on February 15th, with uncertainty about what path COVID will take in the coming months should it be extended once again. Joining us to talk about that are two leaders of Connecticut's General Assembly, 1st District Representative and Speaker of the House Matt Ritter, and 86th District Representative and House Minority Leader Vincent Candelora. Thank you both for being with us. Mr. Speaker, I want to start with you. The governor says he's eager to have some of these things codified by the legislature. It sounds like he's ready to turn the baton over to the General Assembly, but time's ticking.
Yeah, and thanks for having me this morning. It's always a pleasure to be with my friend, the Minority Leader. Look, at the end of the day, I think codifying some of these executive orders makes a lot of sense. I think we're glad to do it. We need to do it relatively quickly in the next couple of weeks. The big issue is, what do you do after that, right? This is a very predictable situation with the virus. We hope that as we get to March and April, quite frankly, we're in a much different place than we've been in a couple of years. But the legislature, I think, will codify it for a certain period of time. I think the unknown is what happens, say, when you get to mid to late April.
Representative Candelora, this is unusual because I was preparing for this interview and reading some quotes from you, and I think your quote was, "What happens after that?" That's just what the speaker just said. So what's your worry about what happens after that?
Yeah, I think, the reality is that to us, the Republicans, the emergency is over. But what we still have is an epidemic that we need to manage. And so what does it look like now as we try to transition back to normal? And so we would like to see these executive orders expire. We could look at what we want to codify, but who makes decisions of when masks need to be purchased or test kits need to be purchased and distributed? There's still some management that needs to occur. And what does that look like?
Because Representative Candelora, that's a big thing with the legislature, is that, nothing really happens fast over there. Even very urgent matters don't really seem to happen quickly. Emergency powers act for a reason, but many members of your party were critical of some of the power the governor wielded. I heard people calling him King Ned and things like that. So do you have confidence that it could happen quickly, or is that your concern?
Well, I think what needs to happen is, I think we need to start seeing public input in this process. So, the nursing home orders that came down yesterday on visitors, I got a lot of phone calls from nursing homes that were surprised by it. They have to implement it on a Saturday. They don't have a lot of time. I would like to see a little bit more of a deliberative process, but we need to be able to have public input in these decisions, because the people that are impacted by these orders need to be able to give input on best practices. And my criticism of the governor is, all along, there hasn't been that input on what our best practice is.
Mr. Speaker, how about from the Democratic perspective? It even sounded like some members of your party were a little frustrated with the timing from the governor, also of your party, that this was sort of coming down the pike so close to the beginning of session. Do you think it's something the General Assembly, both on your side and in the Senate, can get their arms around that quickly?
Yeah, we'll get there, because you have to get there, right? There's just too many important things out there that you can't let lapse in the next couple of weeks. To the Minority Leader's point, if the issue is we need to have public comment or something on any executive order that may come after we codify the existing ones, I have no complaints about that. I'm not sure who the right board is to have those, to solicit that comment and feedback, but we're open to that. I do agree that we are hopefully turning into a new phase of this, which is less where we were in March of 2020 and more where we were last fall and last summer, where you had very low hospitalization rates, lower positivity rates, and really high vaccination rates. So we hope to be able to turn the page and craft something that reflects that. But I will remind people that once we leave session after the first Wednesday in May, it's really hard to get the group back. So for the next 3 months, when we're in session from February 9th to that first Wednesday in May, we can act pretty quickly. We can e-cert bills, we can amend other bills. But once we're out of special session or at regular session, it's really hard to get in a special session. That's pursuant to our state constitution. It's not because people are lazy or tired. It's because it's hard to get in, right? It's not meant to be a full-time legislature. And we have to account for that in case things come back. And you know what? It may be the governor has to declare a new emergency. We may be at a place in May where if he felt some unusual turn had occurred, he has to go back to where he was 2 years ago and say, let's reconstitute an emergency. And we're open to that consideration as well.
And Mr. Speaker, do you know the governor has said that he wants some of these current still in place executive orders to be codified, others to drop off? I know the vaccine mandate was one he said he'd be okay with going away. What should the public expect? Do you have some guidance from the governor's office yet?
Yeah, the request they've made is to basically take the existing EOs, which it may surprise people. There's about 11 of them or 12 or something like that. Yes, he is not going to request the codification of the vaccine requirement or testing requirement for state employees. He will only have a vaccine requirement for people who work in healthcare facilities, nursing homes, hospitals. And then, it will continue with the school mask requirement pursuant to what SDE, State Department of Education, and the Office of Early Childhood recommend. Right now, they're the ones who throttle that up or down. Those are probably the most controversial. The rest of them, I don't think anyone will be against. But we do have that list. And again, we may approve some, we may not approve others. We may amend some, but that's at least what he's recommending to the General Assembly.
And Representative Candelora, how about from your caucus's perspective, when that list comes before you, are there going to be members with a lot of questions?
Yeah, I think we've had a lot of questions all along. Like when it gets to the masking of children in schools, what has been the impact of that? Has it impacted the development of speech? Has it impacted socialization? Is it mitigating the spread of the virus in schools? The Department of Public Health has not provided that data to us. So whenever we do take a vote on these things, we want to understand why they're being put into place. The recent order for nursing homes, we're going to let vaccinated people into nursing homes to visit, but unvaccinated need a test. Well, we all know that Omicron spreads among vaccinated and the unvaccinated. So why are we only testing the unvaccinated? We should be testing everybody entering a nursing home. So those are the questions that we're going to have, and hopefully the administration will be able to answer them before we vote.
Just about 30 seconds left, Mr. Speaker. How about just the mechanics of running this session with Omicron still raging in Connecticut? Is it going to be a tough session again?
It is. It's going to be difficult, and you're going to have more cases than we had before, right? To the minority leader's point, it's more, more people are catching it than it did previously. But the reality is we will have a session. We expect people to be able to come and attend committee meetings potentially, depending where the virus is in the next, 4 to 6 weeks. We expect people to be able to come as they used to at the state capitol. I suspect what you may see revert back to where we were was public hearings. That's the one thing that's really hard to control from a capacity issue. And Zoom seemed to be very popular with a lot of people. So we're going to try to find a hybrid that works, keeps everybody safe. But the reality is if we don't get below 20% positivity, it's really hard to make it work. If we get back to where we expect to be, then it's a lot easier to say, look, we can make this work and keep people safe.
All right, Speaker of the House Matt Ritter, Representative Vincent Candelora, we appreciate you both being with us, and we'll, of course, be following the session as it comes. Thanks very much, guys.